to say that we have a question here from someone who said, how do people in a relationship but not living in the same home manage the foreseeable future given this social distancing?
Can I ask Dr. Adedapo to answer that? Not Mr. Adedapo, the real doctor.
When you refuse to go away now, yeah, answer the question.
Good evening, all. I think we can start now, and we are starting right now. This is 18 minutes past 6. Welcome to, like I've said to someone, I refer this meeting to the General Town meeting. So I'm welcoming you all to this meeting. And like we have all seen from the IV, this is set up for us to ask questions about COVID-19. We all understand that COVID-19 has been very difficult for the community. We don't really understand much about it. And that is why we have put together the group of medical experts to come here and give us the facts about what we don't know. But before I go on, like I want to say to every one of you, this program will be recorded. And let me repeat again, this program will be recorded. And I need to inform you before I start recording. Is that okay for us, please?
Yeah.
Thank you. And to start, I'll be introducing myself. My name is Tola Chigayaba once again. I'll be your host. I'll be introducing myself. My name is Tola Chigayaba once again. Let me mute. Please mute all. Okay, I'm muting everyone now. Ungosi, you can, okay, yeah. All right, so I will be your host tonight. And I have another person that will be hosting along with me, who is Ngozi Ochuba. Ngozi Ochuba, can you hear us?
Hi, everyone. Good evening.
All right. Thank you. And before we move on again, I would like to introduce to you the medical experts that are in our midst tonight. I would like to introduce to you Dr. Toks Shogowawa. Hello, sir. Can we, okay, hold on, let me.
Yes, good evening.
All right, sir, you're welcome. And I have with me, online with us, Dr. Adebola Adisa. Can you unmute and say something? All right, that's great.
Good evening, everyone. Thanks for having me.
You're welcome, ma. And I have with me, Dr. Soya Adedapo.
Good evening, everybody.
You're welcome, sir. And I have with me Dr. Omon Imoyi. Can we hear your voice, please, ma'am?
Good evening, everyone. Thanks for having me.
Thank you. You're welcome. And I have with me Mrs. Funke Agbekwe.
Good evening, everyone. Nice to meet you all.
Thank you. You're welcome. And I have with me Mrs. Kewe Omorado.
Good evening, everybody. Nice to be with you all.
Thank you. Thank you. Both Mrs. Kewe Omorado and Mrs. Funke Agbekwe are specialists when it comes to dieting and when it comes to exercising as well. That is why we decided to include them in this program today. So when the time comes, we'll be asking them some questions. But before we start asking questions, I would like all the people, all the experts that have introduced to us to please quickly tell us in 2 minutes to quickly tell us about themselves and their background. And I'm going to start with Dr. Adebola Adisa. Please, in just 2 minutes or less than 2 minutes, you can quickly tell us your background so that everybody that are listening right now will know what are the type of question and who to direct the question to. So Dr. Adebola Adisa, please.
Thank you. Dr. Adebola Adisa. I'm a GP, also known as family physician in other places in the world. I'm a mom of two. I'm a school governor. I'm a author of, well, 4 books shortly. And I'm interested in women's health particularly. Thank you.
Thank you, Dr. Adebola Adisa. I would like to call on Dr. Soya Adedapo too.
Good evening, everyone. Thanks for coming and thanks for having me in your program. I'm an orthopedic surgeon, a consultant orthopedic surgeon. This forum really applies more to my colleagues who are GPs and public health physicians and A&E physicians. But I suppose I could answer any question that relates to people that probably need surgery or might need surgery around this coronavirus period. So if there's anything you're worried about in terms of you might need surgery, your relatives or families have problems and they might need surgery, I might be able to answer some of those questions. Thank you.
Thank you so much. You're very welcome, sir. And Dr. Tux Sogowawa, please.
Right. Good evening once again, everybody.
Yeah, right.
I'm Tokumbo Sogowawa. I'm a public health physician, just past clinical director of public health. So as you most probably guess, I've been involved with managing outbreaks and epidemics. So in this context, my area of interest will be in trying to prevent, and we'll be talking about testing, tracing, and treating, which is about the next phase we might be going into if we don't have a second wave epidemic. I'll stop there for now. Thank you.
Thank you, sir. You're welcome. Dr. Omon Imoyi, please.
Myself, yeah. Hello, everyone. I am Dr. Omon Imoyi. I'm a GP. I'm a multiple award-winning GP in Manchester. I'm a mom of 2. I'm a wife, and I'm also the founder of Black Women in Health, a partnership network for supporting, connecting, engaging, empowering, and celebrating Black women. I'm a transformational speaker, and I am self-driven, committed, and I love to inspire and empower everyone else to be their best self. So thank you for having me.
Thank you, ma'am. You're welcome. Mrs. Funke Agbekwe, please.
Hi, everyone. Nice to meet you all. Yeah, my name is Funke Agbekwe. By profession, I'm a qualified accountant. I work as a financial controller for a global IT company. But you wonder what I'm doing here, but I love, honestly, I have a passion about healthy lifestyle. And this is why I enjoy to market the products. And the journey has actually exposed me to quite a lot of things in the nutrition world. And I kind of feel and I understand that health is health is wealth. And doctors are doing an amazing job. But I think we individually by ourselves, we could do quite a lot of things, to do a lot with our health, preventing many things. And even in this COVID-19, you agree with me, there's a lot we could do to live a healthy life and actually avoid us from getting into that situation of going to the hospital. Thank you for now. We will talk about it later.
Thank you. And if I call on Mrs. Kewe Omoragbo, please.
Hello, good evening again, everybody. I'm Kewe Omoragbo. My background is in law. I'm a lawyer by training, but I'm really passionate about health, general health and well-being. I'm passionate about anything that's got to do with, looking at how we can take care of ourselves. Like my sister has said, we're just passionate about helping women to inspiring healthy living and also helping women, empowering them financially. So I'm looking at both financial empowerment and health empowerment for both women and men as well.
All right, thank you. You're welcome.
Thank you.
We have to start now. Actually, this meeting is actually set up for us to ask any question, to ask the medical expert any question about COVID-19, and most especially about the recent report we got from the ONS about that the COVID-19 will affect Black people more than the white community. And this is why we decided to set up this meeting. In case you have any question that is bothering your mind that you need to ask. And do we have anyone that would like to ask a question now, or do you want us to ask? Do we have anyone who would like to go first? Hello. All right, Ngozi.
Yeah.
All right, please, can you take over, please?
Oh yeah, that's fine. Hi everyone. Good evening again, and welcome to this segment of opinions. So today, one of the things that we really want to know about from our medical experts is, statistically they say that Black people are 4 times more likely to contract this virus. Why is it so?
Can we direct the question to Dr. Tux Shogowawa, please?
Sorry. Okay.
Yeah.
Right. As we know, I mean, it's relatively new, and it's all the bits of areas where we're still learning. And I'm sure we're all aware that the government is actually doing a survey, looking at this to be able to find some answers to that question. But one can postulate that in the groups where we say, because I mean, there is a bit of 2 sides to the coin. Without being too, in terms of generalizing, one can then look at our predisposition to our underlying levels of morbidity diseases, where we look at diabetes, hypertension, and all that, and then look at a level of deprivation and the bit of, less deprived in terms of economic situation. But at the same time, there are other findings in terms of our cardiovascular risk. People are beginning to look at issues around that the blood clots plays in the whole process. So really, it's a lot of questions that, a lot of theories that needs to be confirmed. The other bit then question that you say, okay, why then is it happening here? And then where at home, where the climate is tropical, that we're not seeing more as compared to this into these regions in this cold climates. And if you remember also, we don't have flu as such at home, the tropical seasons, but we have it here. So there are quite a number of questions, but yes, the statistics or the data we have now shows that. And the theory, what is being put forward, is the underlying disease conditions, our predisposition as Blacks. And then what has come up also is the vitamin D deficiency also. And there is a theory also about our Black skin, that in this weather that we're in, the melanin in our body makes it quite difficult for us, unlike when we're at home, where it's already been stored. So there's some of these theories also, and that's why there's been a lot of push, a lot of things in the social media about vitamin D also, that we have quite a number of us here who have vitamin D deficiency because we are not as exposed to the sun that we normally have at home. So in summary, there are a lot of theories, explanations to explain, towards this, but at the same time, the government is actually doing, I mean, you've set up a committee. I think he said it by Kevin Fenton, who is a colleague in Public Health England, who is a Black man, just to mention that, to look at that. But how far that will be able to answer the question, we'll wait and see.
Thank you, sir. I have somebody who would like to ask a question. Titilayo Adelakun, are you with us? Can you unmute and ask a question, please?
My question is, what long-term containment measures can you suggest towards living a balanced work and lifestyle towards COVID-19? Because it looks like we are in a long haul. This is going to take a very long time to eradicate, if at all we are able to do that. So is it going to be like lockdown, go back to work, lockdown, or, you know, what does the future hold? You know, what sort of lifestyle are we going to be living?
Can I put that, are you true, Titilayo?
Yes.
Okay, sorry, Titilola. Can I put the question straight to Dr. Omon, please?
Yeah, hello, Chiti. Thanks for your question. So, yes, I think, you know, according to the public health guidance and the daily COVID briefings we've been getting, they've put a five-level system in place, and we've been on level 4. So we are cautiously going down to level 3. So basically the level is from 5, where it's red, to amber, to light amber, to yellow, to green. And we are currently on level 3, where they are trying to ease off the lockdown. And they are doing this gradually from, you know, different types of businesses to different organizations. And the whole idea of the gradual easing off is to reduce the risk of a second wave, because there's this fear that there might be a second wave, which might actually be more dangerous than the first wave. So the whole idea is to do that system gradually. But the key message that we all have to take home is that we have to follow the Public Health England guidance, which is that we need to practice social distancing at work, when we go shopping, when we go out to, you know, do our daily activities. What they've recommended is now you could stand a few meters away from someone and speak to that one person. We should avoid large crowds. So that's why we're having virtual meetings like this. And this is what's recommended for most organizations, to have their meetings virtually, because it prevents the risk of many people being in a room. The other thing is, obviously at work, people have to take precautions. So for anyone who's already at high risk, if you're BAME or if you have any medical condition that puts you at high risk, the advice is to get yourself risk assessed at work. Most organizations have forms now where you can complete, you know, tick some boxes to see your level of risk, and you know yourself as well. Express yourself to your boss or your organization, HR or occupational health, to tell them what risk you might be at, and they can risk assess such person. Another thing that they've brought up is using face masks. So when you go out to public places, the face mask in itself is not to prevent you from having the from being sick. It won't automatically prevent someone from catching the virus, but it will reduce the risk, because, you know, it's pass-through aerosol. So it reduces the risk when we take those extra measures, sanitizing your hand. But generally, for all of us, we have to take, you know, conscious efforts to make sure physically we are healthy, and also mentally that we are well. So physically means like eating healthy foods, getting regular checkups. Most people from the BAME community, like the doctor said before, one of the things that we found out that's put more people at risk is the fact that we are more predisposed to some certain conditions. And unfortunately, our community, we are less likely to be diagnosed of certain conditions. We might have some of us going around. So simple things like checking your blood pressure, you know, doing, you know, regular exercise, eating, cutting out any bad habits, and very importantly, taking vitamin D. Those are simple things we can do. We don't know for sure when this whole saga is going to end, but there are a lot of works going on, you know, trying to create medications and testing as well. There are different tests out now, but for the NHS, there's just one main test at the moment. So it's just really, we all have to be precautious and take those precautionary measures when we are out and when we're at work. And of course, if your job is something that can be done at home, then by all means, try to work from home just to reduce going out.
Okay, thank you for your answer, for your response. I personally, because I work on the ward, I'm not a clinical person at all. I do.
Hello.
Sorry, hello? So,
No, it's okay, continue.
Yeah.
Okay.
So I'm not a clinic, sorry. Can I continue?
Yes.
Okay, I'm not a clinical person, but my work is such that, for business continuity, I have to be at work all the time.
Mm-hmm.
So I do see what is going on. Personally, from my own observation and from the statistics, I do not believe COVID is easy enough in any way.
All right.
I want to believe that the government is hiding the true statistics from us. I do want to believe that. And I think as a group, and this is why I have particular interest, for those of us that are actually evidencing this in real life, I do know that for those who are GP, you might be able to work from home, but it's a different scenario in the hospital. Sometimes the PPEs are not there for the people that need them. The ward that I am attached to started off with one patient, and then two bays are all, transmitted, or what do you call it, infected with COVID. I've got a staff as well that's down with COVID in just within a week of easing off. So I do not want to believe that COVID is being eradicated gradually, or probably the lockdown. I think the lockdown is too soon as well, or probably it's not even working, because if people have to go down, that means you will see a surge in the disease again. So this is my own fear, that we need to let them know. We need to let them know what we want. For example, they want the schools to come back, but the union, thankfully, they pushed against that. But we need to know. We Blacks are the ones suffering it most, and we need to raise a voice, and we need to let them know that no, this is the case. The government is only doing what they're doing because of the economic implications. That's the only reason why they're pushing. They are easing it off. It's not the COVID is not in any way easing off at all. So these are my concerns, and this is the main reason why I'm particularly interested, because if we are safeguarding our own interests as Blacks and as minorities, we need to get our voice, and we do not need to bottle it up. We need to let it out. We need to let the whole world know that this is the situation and this is what is happening.
All right. Thank you, Titi Lola.
Okay.
Oh. Hello?
Hello?
Okay,
Yes.
all right. Thank you.
Do you want me to say something about
Yes, you can quickly say something.
Okay, just first and foremost, the government will, I can't speak for the government, unfortunately. I can only speak from my perspective as a healthcare professional. And I've been following closely the briefings and, what's going on with the COVID. I know there's been, unfortunately, a high rate of deaths in the UK. But according to the statistics we've got, there's been a decrease in hospital admissions up to 11% in the last couple of days. And also, the UK has, started testing vigorously. As at 2 days ago, over 2 million tests have been done in the UK. And in one day alone, they were doing over 100,000 tests. So I think from the point of view of that aspect, they are actually doing something. Unfortunately, COVID, we don't know when it's going to end. I'm not saying COVID has been eradicated or it has ended. The lockdown is what is easing off. The lockdown has to ease off for some certain reasons. Of course, economic reasons is one of them. But at the same time, that's why I said everyone has to get risk assessed and work. Because unfortunately, the hospitals have to keep running. The medical services have to keep running, because we are the ones on the front line to take care of the patients. I've had to see patients as a GP during this time. And all I've made sure is there has to be enough equipment for me when I need to see the patient. I need to have the right PPEs, and I need to make sure I protect myself very well. I've done my own risk assessment at work, and I've encouraged everyone I know to do the same. And if you don't feel safe working in a certain area, or you feel that they've not provided you the right equipment, then speak out. That's what I'm advising everyone. Speak out and tell them, unfortunately, I'm already high risk. I can't put myself at more risk. And that's where, you know, we have to use our voice in that instance. But I can't speak for the government about the statistic, not the data or all that. But obviously, from what we are getting, I take care of 2 care homes, and I'm seeing what's happening there as well. But at the same time, everyone working in that care home cannot abandon it because of the COVID. Who will take care of those people? At the end of the day, the whole idea is that we need to risk assess ourselves, make sure that we have the right equipment. Of course, speak out if the right equipment are not there. But this is unfortunately one of those battles that we healthcare professionals have to be the ones in the front line for. And, you know, a lot of our colleagues, unfortunately, have lost the battle. And it might have been due to many reasons, including poor PPEs. But that's why we need to speak out at this time. But it's inevitable that we'll have to be on the front line.
Thank you, ma'am. Thank you. Ngozi.
Yeah.
All right.
So I'd like to direct a question to Dr. Adedapo. He says, what do surgeons consider before they operate during this period? Because a few people who have been operated on, they've had orthopedic operations, have now unfortunately been confirmed COVID positive. Hello?
Yeah, I hear you. Okay, COVID. COVID is good news and bad news as far as COVID is concerned. Ever since God created man and devil showed up, there's been bacteria and viruses, and they've been killing people. Okay. So bacteria and virus will continue to kill people. But there's something called the immune system. And it's been very effective, because if it didn't work, none of us would be here. We would be all dead. So take heart. Sooner or later, COVID will go away. And if it doesn't go away, it will become like common cold, seasonal flu. You'll get it, you get better, or you get it, your time's run out, you die. It's that simple, okay? The point of the matter is, whether we like it or not, I know that the health, whatever he calls himself, the medical director for health, the initial thing he said, they said they were looking for that herd immunity. That's still what they've gone to do. That's still what's going to happen. Because unfortunately, if lockdown is going to work, you need to do it really, 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 really early and vigorously. Lock everything on. Nobody goes anywhere. 1 month, 6 weeks, nobody goes anywhere, not even to the shop. And then you control it. Because then it dies out. The trouble is somebody else will bring it in again, because unfortunately we live in a global village now. We're so interconnected. People have to go places. So very effective lockdown is very, very difficult to do in a country that's like the UK, that's so connected. All this time we're talking lockdown. There's still flights coming in by BA. It's never stopped. So did we really lock down? I'm not sure. But most people still felt lockdown. So coronavirus is a viral infection. So every time you get that infection, your body is fighting it all the time. Everybody's body is fighting it. Some people fight it so well, they don't even know they had a problem. I know colleagues who've had coronavirus, and I called them up. I said, where are you? They say I have coronavirus. I said, how did they know? They said they just swabbed me and they said, go home, you have coronavirus. So what are you doing? They said, I'm sitting in my garden drinking beer and cutting my lawn. You're not sick? He said, I'm not sick, nothing is wrong with me. But they say I must go home. Meanwhile, that same virus, somebody else gets it, gets desperately ill, has to have intubation, ventilation. Some of them die. So what are we saying? This is nature at work, at its worst, and if you have the good immune system, at its best. To answer the question of the people that are having surgery, the trouble with this infection is, okay, currently I'm an orthopedic surgeon, and we're not allowed to operate on anybody except trauma. So the only operations we're allowed to do now is you break your leg, you broke your arm, you fell out of bed and broke something, you fell out of a tree, whatever. If you break something, we're allowed to mend it. If you don't break anything, we can't do any surgery. So hip replacements, knee replacements, those kind of operations, they've suspended those. Because most of what I do, if I don't do the work, you won't die. It's that simple, except for probably major trauma. The trouble is if you bring a lot of one of our sisters talked about people in nursing home. The trouble with nursing home people is most of the residents are older people. They are generally their immune system isn't as great. If they get the regular flu that comes, winter bug, they're the ones that they say they must get immunization because they're most susceptible to that winter bug. So if you now multiply the virulence, that is the craziness of that winter bug by 10, you get a coronavirus. Unfortunately for those old people, now they don't even have that vaccination for that coronavirus. And they can get it as easily as they get the flu. But they're now getting a bug that's 10 times worse, which is why it's killing them off. The trouble is by the time they come to hospital, and this has happened in several hospitals. So everybody who's having surgery now, when they come in, because it's an emergency, they can't really wait too long before they do their surgery. So they swab them for coronavirus. And until recently, a lot of the tests were taking 2-3 days to come back. So they've now taken them to theater and done their operation, maybe put a new hip in because they broke their hip. By the time the test result comes back 2 or 3 days later, they are now found to be positive. 2 things have happened. You've exposed your staff to coronavirus. Now, which is why a lot of the ethnic minority surgeons were in a lot more trouble, because at this time, I remember telling my anesthetist, I said, this is going to really be a problem for our doctors. Please start wearing PPE now. Insist on wearing PPEs. And every doctor that I've met, I have insisted that they wear PPEs from the beginning. So fortunately for us, we have been fine. We started wearing PPEs early because I got a lot of WhatsApp messages from my colleagues outside the country, in Italy mainly. And so we were up front with that. So we didn't have a lot of trouble. None of our anesthetists have been ill, actually, because they just wore their PPE all the time from 4, 5, 6 weeks ago. Some of the surgeons didn't, but they were protected enough. So the point is these patients then get ill with coronavirus after the surgery, which they had before they came in, remember? And once you do surgery to somebody, surgery is stressful. Breaking your hip is bad. Surgery just adds to the stress. So you've now stressed the body, and that stress, surgical stress, depresses your immune system even more. So for the patients who've had coronavirus and then they've broken their hip, they've had a hip operation, well, their mortality rate is more than 50%. More than 50% of them will die. Under normal circumstances, if you're old, you break your hip, you get surgery very quickly, very effectively. Your mortality rate, the chances that you'll die is 5%. But if you break your hip and you have surgery, the chances that you're going to die is more than 50%. If you get coronavirus on top, you are reaching 60%. So these are the problems. So going forward, until we find out how this, and part of the problem is nobody quite knew how this virus was going to behave. People are learning all the time. So all the advice they keep giving you, that's why they keep changing it every 2 days, because they themselves didn't know. But what I wish they would have done is, we don't know anything, no, but just telling you what we think, okay? And that would have been the truth, because they didn't know anything, and they were just making things up as they went along. It is the truth. Because they were getting information, same way you're getting it now, they're getting it. I'm still getting information on WhatsApp, on my phone. People are publishing newspapers. Hydroxychloroquine, does it work? Does it not work? Is this drug working? Is it not working? People are doing trials and tests. Sometimes some drugs work if you start it early. If you catch the patient early, you start. Once the patient is very sick, those drugs don't work again. Sometimes it's like that. So surgery, is it safe? No, if you have coronavirus, you should not have surgery. So going forward, everybody's going to be tested for coronavirus. And if you're positive, you can't have an operation. If the operation is life-threatening, say if they don't do the operation, you're going to die, then you have to have it now. Because if they don't do the operation, you'll die. But if they do the operation and you end up with coronavirus, your chances of dying is much higher. Because surgery is stressful, and surgery depresses your immune system even further.
Thank you, sir. I've got 2 people that have asked the same question about the children. That is it safe for the children is it the time for the children to go back to school? Is it really safe for them? I'm going to direct this question to Dr. Adebola Adisa.
Thank you. I think it's an appropriate question, and it's what is on every parent's mind. And I think by virtue of also being a school governor, I guess maybe this question is rightly directed to me as well. No one can say for certain that it's 100% safe for you to send your children to school. But I believe that we're going to have to depend on our government to make certain decisions for us. I believe that we're going to have to hope that the government is making the right decisions in terms of when it is safe to start sending the children to school. So there's some basic facts with children with coronavirus, and which I'm really thankful for, and all of us are thankful for, is it hasn't affected children. In fact, until maybe the last 4 weeks, very few children have died from coronavirus, which is a good thing in that even when they do have it, they tend not to be very ill with it. But some children have been ill, we need to know that. But it is very rare that children will be, you will have fatal, impact from coronavirus. So that is a plus on one side. But on the other side, we also know that they could possibly, have coronavirus and spread it. That is also a fact to some extent. But we must understand, like Dr. Adedapo said, it's like a learning process every day. That's why no one knows. That is why it's called the new coronavirus. We do not know for certain. I guess maybe in 5 years' time, in retrospect, we would all know the truth. So there are a lot of facts. In terms of sending your children to school, no one can say 100% your child is going to be safe, you're going to be safe when they contact other people. But based on the facts that children are unlikely to be affected or become very ill, and based on the fact that, as I said, I'm a school governor, schools are doing a lot to try and curtail. We must realize that all along, key workers have been sending their children to school, and because they've got to go to work, they are at the forefront, like was previously said. So schools are doing a lot. If at the end of the day, decision is that schools should open. Schools are doing a lot, what they call a bubble. They're kind of going to do a bubble kind of practice where they're going to try and maintain social distancing as much as is possible, bearing in mind that these are children. There's only so much they're going to see their friends, and immediately the first thing they want to do is hug them, like you would as an adult as well. Schools are trying to do a lot, and they're putting a lot in place to curtail and limit how much this virus might spread. They have a lot of processes, systems in place, and hoping to be ready for the 1st of June if school decides to open, if the government says, school should open. There's not going to be, as at present, the school is not going to be putting in place measures to say you must bring your child. If you don't bring your child, they'll mark them absent, or there will be some sort of repercussions. Because again, no one can say 100% that your child will be fine. So if you ask me, am I going to be sending my child to school? At present, the answer is yes, because I've got to go to work. Somebody has to go to work. But I cannot make that decision for any parent. And I don't think anybody can make that decision for any parent. I don't even think the government wants to make that decision for every parent. But I wish they would, because I believe that there are certain things that shouldn't be left to the discretion of parents. Something like schooling. I don't think parents should be left in a position where they have to be making that kind of choice. should I send my parents child to school or should I not? I think it's a difficult decision. But at the end of the day, we're going to have to do what we can sleep with. So I know it's a very tricky question. All I can say is that schools are doing all they can to make sure if you do send your child to school, they're going to be as safe as possible. But if you do decide to send your child to school, don't leave it just at the school's responsibility. So right now, your child must know, what social distance, what coronavirus means, what social distancing means, what they need to do when they get to school. You cannot hug your children, your friends. You cannot, be in close contact. How much distance should you be apart? They need to know that now so that when they get to school, it's second nature to them, and they are doing their best as well as helping the school to get through this. I hope I've answered your question, but bottom line, a simple answer is no one can tell you 100% that your child is safe. You're going to have to make that decision, but I'm hoping the government can make the right decision regarding, schools opening or not. Thank you.
Thank you.
Could I just quickly add to that?
All right, please.
That's what Dr. Adisat said.
Okay.
Why the government cannot make that decision also is because there isn't enough evidence for them to act on. And just for all of us parents, the government is set by 1st of June. And I'm sure you are aware, even in Teesside, one local authority is saying schools are not opening. Another is saying they will start working on it. It's just to show that is this balance of striking in economic and safety and health. And Dr. Adisa already talked about people who go to work. Well, they will rather send their children to school. But then schools are at different stages. The things they have to put in place to be able to ensure that social distancing will be a challenge from one school to the other. There will be funds. And then Dr. Azad also said about how do our children behave? How would they be able to cope with social distancing in such an environment, particularly in year one, those very young people? And I've seen a question there, which is actually a good point, that is it not even worse sending them to school where they're amongst their friends and you want them to social distance rather than when they're at home in the environment where everybody's been sharing whatever coronavirus is there? And that comes also to that question that bit that Dr. Adeptapo said is, do we actually just let this thing run? People develop their immunity, or to some extent, well, it might be the kind of a natural selection. And if you remember, okay, I don't want to quote that on the media in terms of the American president's views about the contribution and all that. So bottom line is, issue of school, because there isn't enough evidence, it makes it very difficult. And that's why we're having differences. The government have said it, and the union, teachers union, have met and have actually asked for evidence to say this. And that is gathering. And then there is the local setup about, even if the evidence is there, how do you assure that the school is actually set up to be safe, one-way system, social distancing, going to toilets, and then even the space in school. So it is quite tough, and it might actually be a situation where, as a parent, you now make that decision. You may then look at your child's situation. Is my child more vulnerable? Does my child have some immunosuppressive or some conditions that make him or her more vulnerable to expose to that? What are my own individual circumstances? Dr. Decided said she's got to go to work. And then you look at all that. And that's why it might be best, like Dr. Adedapo said, maybe best thing is just lock up. The question is, why don't you just lock up the schools till summer? Hopefully we'll have that picture. That's another option, which some countries are looking at. Even some classes are looking at that, because the question is, between now and summer, what level of education will the children miss that will make that greatest impact? But remember also, we the BAME communities have also been pointed out that we're actually more at a disadvantage because of the method of teaching, access to internet and all that, that we may even be suffering more by this lockdown, non-opening of schools. Thank you.
Thank you, sir. Let's quickly shift a bit to the dieting side. Mrs. Kewe Omorago, are you here with us?
Yes, I am. Thank you.
All right. I sent a question to you from one of the participants. Please, can you answer the question for us, please?
Okay. Right. I think it's got to do. I'm just trying to look for the question. So.
Okay.
How do I lose 10 kg in 2 months? I've struggled to lose it, though I do not eat carbs, and but my job is
stressful. Yeah,
which is what I think is making it difficult to lose. What can you suggest? I work for 2.5 hours, 3 days a week, and 40 meters cycling 3 times a week. But the scale isn't budging much. Wow. I want to congratulate whosoever this person is. You are doing a good job. Well done. I'm not even half as good as that. But honestly, I don't know how that person is managing without eating carbs. I'm not a medical expert. Yes, I'm passionate about general health and well-being, but the little I know is that we need to eat a balanced diet. We need to eat a balanced diet. Of course, yes, in the correct proportion to support our health. So I wouldn't personally say that somebody should cut out carbs from their diet completely. So I'm wondering, how do you have all the energy to do? Maybe that's one of the reasons why you feel your job is stressful, because you don't have enough energy and you still do all those exercises. So I think our health is more or less having a kind of balanced lifestyle, you know, balancing, eating healthy, yes, with the exercise. So I would say yes, and I'm sure our medical experts here will be able to put us through more. But yes, eating a well-balanced diet, yeah. But of course, you are looking at foods that are low in calories, low in carbs, low in fats, but not necessarily cutting carbs out of your diet. I don't subscribe to any diet program. You know, I don't want to mention any name, but I don't do any diet programs that will begin to tell you, don't eat this, don't eat that. Yes, I believe in moderation. Yes, I believe in, yes, looking at making those little health changes. You know, most of the things we are talking about here that are affecting we people of color has got to do most of the time with our diet. We eat food very high in carbs, very high in fats and all that. And those are some of the things, because we are not burning them up in the kind of world that we are in. And those are the things that are impacting on our health. So I'll say for that person who is trying to lose, I think, yeah, you should just try to strike a balance. You're having a good, very, very, very good exercise regime, but I think you need to look at your diet, you know, rather than cutting out carbs completely. Try to look at how you can have that kind of balance so that you are still eating some amount of carbs in your diet on a regular basis every day, you know. And once you do that, then look for food that will also support your general health and well-being. Eat more fruits and vegetables. Eat food that will boost your immune system. That's, you know, that the bottom line of what we are talking about today. It's about, you know, how we can boost our immune system, because if our immune system is boosted, you know, those with comorbidity issues and all that, you know, they some of them wouldn't have, you know, gone to the great beyond. So yeah, for that person who sent the question, I would say yes, please. Our health is a total package, and we need to find that balance so that we are able to achieve the results we want. So if you are doing well in one area and you're not doing well in the other area, you want to look at what you are eating, look at your diet, and yes, you need to begin to think of the choice of foods that you can use, you know, to have that balance in the amount of nutrients that you are consuming on a daily basis. Yeah, I don't know if that has helped. And I'm sure some of my doctors, Dr. Bola, I'm sure she will help me to also chip in one or two things to answer that question correctly.
Thank you, Ma. Please, I quickly want to talk to, what about Mrs. Funke Agbekwe? Mrs. Funke Agbekwe, are you here, please?
Yes, I am.
All right. In one of your testimonies, you said you it's been very difficult for you to get on. Exercising has been very difficult for you in the past, but right now you are finding it very easier to do. Please, can you quickly tell us why you said so? Because we believe exercising, dieting, and health care system is part of what we should
like to kind of share with
care.
everybody. If if you want, you're looking for something out there to kind of help you to boost your body metabolism. So I started to take it has really increased my body metabolism to the extent that in the past I can't just physically run for a bit, do a jogging. I mean, I do walk, and everybody tries to do that. Sometimes you do that 10,000 steps a day, and you just don't see the benefit of it. And because people are actually, sometimes starving themselves because they want to lose weight, and they are losing weight in an unhealthy way. So therefore, your body is lacking some vital nutrients and, things like vegetables and fruits and, things that can help you, that you are actually losing weight, but in a healthy way. And you are building your immunity to fight against any sickness and disease. And you will agree with me. I mean, the doctors are here that quite a lot of diseases are linked to sometimes poor healthy diet. If you are eating correct diets by making sure, I mean, they do say 5 fruits and vegetables a day, but you probably need more than that. And sometimes even those 5, you might be too busy. You might be too busy with your day-to-day life, and you're not ending up, taking them, or you're not taking them the right way. So there come our products to help you to bridge those gaps. So when I started to take these products, amazingly, I can do some running. Honestly, I couldn't do, press up. I can do some girlish press up now. I can do quite a lot of exercises that I've never been able to do. And overall, even in my health life, things like, you kind of have some, you think I don't know how many people have it, some bad breath odor. I don't have it anymore. I don't have any teeth pains or, gum pains or stomach cramps and, things like all this bits and bobs. And even one important one I would mention is, I don't know, so many ladies are out there. They do have this thing called low iron. And I used to have low iron a lot. And I've been trying to buy different types of, doctors have prescribed to me several occasions, iron tablet, and I'll take it, but I can't continue to take it all my life. But when I start to take this product, I don't even, with all the other health tips as well, I've been able to know, I don't even have any low iron anymore. I just see myself that I kind of have that, that strength, that stamina. I used to have pains because my work as an accountant, I sit all most days, and I work from home even before COVID-19. So because of it, the answer there is that I'm sitting at my desk and I'm sitting for long hours, and I'm always having body pains, neck pains, and it was affecting overall my health living. And in the moment I started to do some exercises every day, going on treadmill, having a walk, and I'm even adding to it now to jog, actually, jogging, or, doing some exercise, indoors exercise. I discovered that I don't even feel any pains anymore. I don't have to take paracetamol. I don't have to take ibuprofen. I don't have to go to, even I used to go for massaging, and it would just relieve the pains a little bit, and, having all this yoga exercise and things like that, all the pains I've got. I don't have to go to the doctor every time. I keep saying, I'm feeling pains here, I'm having this bloating here and there. It's just amazing. And I'll stop there.
All right, thank you. Thank you. Dr. Imoy, are you with us? All right, I directed a question to you.
Okay, underlying conditions, will it be helpful to specifically spell this out? Okay. So most of the underlying conditions that, that I mentioned before when I was talking about Black people being more predisposed is mostly health-related conditions like high blood pressure, okay, diabetes, high cholesterol levels, some endocrine conditions as well. But when you focus mostly on high blood pressure, and I would focus on those because those are very simple ones that we can actually manage with lifestyle changes. So high blood pressure, for example, a lot of people walk around, they don't even know that they've got high blood pressure, because high blood pressure does not have symptoms sometimes. People can have it for a long time and they won't have any symptom until one day they have a stroke or a heart attack. And that's why it's important that everyone, especially over the age of 40, should get their blood pressure checked regularly. Actually, the NHS has something called the NHS Health Check, where everyone over the age of 40 should go to their GP, and they have blood pressure check, and then they have all the blood tests, which includes cholesterol check and diabetic check. Again, diabetes is something that some people walk around with without even knowing. They might actually have symptoms, but they might mistake it for something else, or they might just ignore it. One thing about our BAME community is that we tend to wait for things to be, is the bitter truth, but it's the truth. We tend to wait for things to be at the worst. And it's not really our fault, it's our health-seeking because grew up in a country where there was no free health at point of contact. And it was difficult for some people, and some people had to, of course, some people go to private hospitals, but the government hospitals were not up to par as well. And then it just made us that way, made our grandparents, great-grandparents, and our parents, and then most of us are still thinking that way, even though we're in a country where there's GP services that is free. We still don't access them. So these things are simple things. Going to check your blood pressure regularly, or even buying a blood pressure machine at home. You can just speak to a healthcare professional and ask them what should the normal blood pressure be? And if it's higher than that, then you can alert your GP and say, I've checked my blood pressure, it's above this number, I'm a bit worried. And sometimes people actually have symptoms, like someone saying, I have a headache all the time. It could be blood pressure, it could be anemia, it could be many other things. And people don't go to the doctor, they self-medicate and continue self-medicating until one day it blows up into something bigger. And that's one important thing that we have to be aware of. We have to be conscious of our health in the BAME community, because a lot of people, before COVID, a lot of people have been dying of simple things that should not kill them. Because number one, we are not health conscious. Even when everything is free in front of us, we don't assess it. And again, there's a religious element to these things. So there are some people that feel, oh, I'm praying about it, there's no need to go to my doctor. I'm praying with my pastor, I'm fasting. And we need to, God has already put these doctors there. So, that's why it's there. There was a case I heard in Manchester, that was last year, of someone who passed away from breast cancer, and that was needless. She knew about it 2 years before, but she was praying about it for 2 years. And that's one of the most common cancers in women, but that's one of the least that women should die from. It's curable. So again, it's health awareness, it's health education. We need to empower ourselves. So why I use high blood pressure as an example is that it's a very simple one. It's something that everyone should know their blood pressure. What's your normal blood pressure? Everyone should, above the age of 40, really, everyone should know what their normal blood pressure is. So that the day it's abnormal, you know that, oh my God, it's normally 120, but today it's 150. There's something wrong. And again, cholesterol is something that everyone, again, from the age of 30, you can actually, any age you can get it checked, but these are very critical ages because these are the ages where the body, tends to succumb to most of these conditions more. And again, our diet, like someone has already mentioned, was talking about diet. Our diet is a bit on the fatty side and starchy side. So we eat a lot of carbs, we eat a lot of bad fats in our African diet. And these are things that we need to look into as well. Consciously, we have to be very intentional about our diet and trying to eat healthy. Sometimes it's about the timing of the meals. We eat late or eat too early, or you eat the wrong food at the wrong time, like eating pounded yam at 10 p.m. It's not going to digest well now. And imagine someone doing that consistently, like almost three days a week. They're eating pounded yam at 8 p.m., 9 p.m. It's okay to eat this food, but in moderation and at the right time of the day so that the body can metabolize it. Again, when you talk about diabetes, that's another thing. We eat a lot of sweet things, a lot of sugary foods, and sometimes people might have symptoms and sometimes people might not actually have symptoms. But if you check your blood, if you have a blood check regularly, like every 12 months, if anything changes or if anything is amiss, then you'll be picked up as well. So that's another way. And it's the same for cholesterol. Cholesterol being high on its own, it's more of the risk of the cholesterol, because we all produce cholesterol. But some people maybe might produce more, or due to dietary or lifestyle, and some people it might be genetics. And the cholesterol, if it's too high in the body, it can clog up the arteries and block it. Imagine a water pipe being blocked by cholesterol. The person might, sorry for using the person might not feel anything for years. And one day the cholesterol will totally block it. And that's the day that they will have a heart attack. But if they've had blood checks and regular checkups with the doctor, then they will be able to pick this up earlier if it's a bit raised, and then they can be advised on lifestyle changes like healthy eating and activities, or be put on medication. With regards to the lady who, Fumi, was it Fumi?
Funke,
I was talking about, Funke, I was talking about exercise. Yes, I totally agree. It's very, very important to be active. You know, obviously it's very important to exercise. But even if you go, imagine going to the gym, you've gone down 1 hour, lifted all the weight, done everything, you come home on the yam for breakfast, lunch, you just pack jollof rice, evening, beans and something. Or, you understand what I'm saying? So even if you're exercising, you have to make sure that you're also eating healthy. It's very important. Unfortunately, the healthy foods could be boring sometimes. You can spice it up. You can make it, you can focus. What I always tell people is don't try to follow a specific diet. Focus on what you like. And if there are foods that are very rich in carbs or bad fats, you know, minimize it. Because most of us, myself included, we've tried every diet under the planet. And you find that you're doing this, keto diet. You do keto, do maybe like 2 weeks into the keto, you start noticing small weight loss. You have yourself like, today is cheat day. That cheat day, everything you didn't eat for the last 2 weeks, you eat it that day. The next day you say, I can't kill myself, let me continue. That's how the diet just goes. And then maybe 3 weeks later, you say, Atkins diet or Mediterranean diet. And those things might not be foods you like. And that's why it's tips for dieting is, of course, it starts in the kitchen, and it has to be foods you like. Because if you eat foods you don't like, if you eat things you don't know, because you've seen it on one diet website, after 2 days, you'll just be tired of it. You know, and also spice it up, make it varieties. Don't just stick to, you know, someone say, I'm going to have egg diet. I've done it before. I'm talking from experience. I'll boil egg for the whole week. You get tired by Friday and the gas everywhere. So you don't want that. So at the end of the day, it's about sticking to, you know, varieties and making sure that it's something you like, and making it involve the family, involve the kids, involve your husband. Because for us women that are married, sometimes we say we want to be on a diet. If your husband does not want to be on that diet, it might be difficult, because when you have to cook your own food, he will now tell you, no, this is what I want. And by the time you make his own food, you feel like, man, this food looks better than my own. So it's about, you know, discipline as well, because if you're not disciplined, then you can't really keep eating healthy. So it's eating healthy, exercising, and it doesn't have to be only the gym. You can go cycling, like someone said in the group already. You can exercise at home. There are a lot of YouTube videos where you can actually stand in front of your TV and do all your exercise. You don't need to, like ladies that have kids and can't go to the gym, or little kids and you can't go to the gym. For me, I have little kids, so exercising at home is like my main thing, or we take a walk together with the kids. And those are simple things that you can do. I think it's starting from simple things. Someone once told me that don't aim to do 30 minutes exercise the first day. Start from, maybe I'll do 2 minutes today. By 1 week time, you'll be doing 5 minutes, and gradually it will build up. So just take it one step at a time and be realistic, you know, realistic. Do what you feel you can. So that's my take.
All right. Thank you so much. Please, Dr. Adebola Adisa, I sent a question to you about mental health. Have you read that?
Oh, I didn't see it. Which
that's a question that was sent about mental health. Let me.
Doctors, is mental health issues likely to be on the rise when coronavirus pandemic dust settles? Is that the question, sir?
Yes, please.
Thank you. Yes, we know that. In fact, if I were to generalize, maybe more than 50% of the consultations I'm having these days are about mental health issues. And that is not surprising. I mean, every Tom, Dick, and Harry is worried about coronavirus. If one is not worried about coronavirus, I think that's abnormal. you know, it's normal to be worried about something you don't know about. So that in itself is not an issue. Worrying about something we don't know, every one of us worries. But, you know, because it's uncertain times and this is going on and on and on, and many people have also died from this, and there doesn't appear to be a cure in sight, the worry levels are bound to increase. So, you know, more anxiety, more depression, more panic disorders. In fact, we just finished the mental health awareness week, week in the last week, you know, where we don't know what's going on. And those are the things that can feed into that. Not only that, we're also socially distancing and self-isolating and shielding, which means, you know, what things we are used to seeing our friends, you know, our family members, even your neighbors, you're not seeing anyone basically, for those who are completely shielding for 12 weeks. And some, you know, all of us have to kind of socially distance ourselves a lot. So yes, you know, all those kind of things are bound to affect our mental health, and our anxiety and worry levels and all sorts of, you know, mental health conditions increase. What, you know, in terms of what do we do about this, I think is the question we should be asking, because we already know that, you know, anxiety levels and mental health conditions will increase. And, you know, even after all this is resolved, there will still be aftermath. You know, people have lost their jobs. They don't even know if they're going to have a job to go back to or a business to go back to. So there's a lot going on. What do we do about this? Like I said, is a question I think we should be asking, asking ourselves. I think we have to start now, trying to deal with this from now. We need to start building things into our life and our lifestyle now, in anticipation, you know, that, okay, I understand, you know, with the fact that I'm not seeing friends, family, I'm a bit low, I'm a bit depressed, you know, I'm sleeping less, I'm worrying more, I'm crying all the time. We need to recognize what the symptoms of mental health conditions are. Not, you know, all I'm doing is worried all the time. I cannot stop. You know, I'm not eating well, or I'm eating too much. Those are, you know, common signs of mental health conditions. We need to recognize and reach out. The fact that we're socially distancing or shielding doesn't mean that we cannot still be connected to people. In fact, more so now, we should be staying connected. For instance, we are having a meeting via Zoom, something that, you know, would have taken lots of, you know, months or weeks of planning. We're able to do that. So there's a lot of technology at our fingertips that we can use to stay socially connected. We need to be, you know, picking up that phone and calling people. We need to be reaching out and telling them, you know, I'm not all right, I need to speak to someone. You need to be reaching out to people that you know, maybe they would normally have called you, they will normally, you know that there's something wrong, they're not reaching out. We also need to be asking people, are you well? I mean, don't just say, are you well? Like we would always say, you know, how are you? That kind of thing. Like it's just, we're just greeting someone. We need to really ask, how are people doing? Are you fine? Is there something going on? We need to be interested in each other, basically. So yeah, we need to, you know, recognize if we are facing mental health conditions, or if we're going through things. Like I mentioned, the you know, NHS website is a very good site to look at if we're worried about anything about our health, and you know, instead of going just anywhere on the internet to find out what's going on, which will bring up all sorts of jargon. The NHS website is a very good website to check. You know, you look at anxiety, for instance, look at all the symptoms they've said, and if you're facing things like that, it's time to reach out, you know, speak to, get a, you know, an appointment with your doctor. If, you know, most surgeries are operating that sort of telephone consultations to start, initial telephone consultations, or just speak to someone, you know, take care of your own mental health. There's a lot of websites, even on the NHS website, where you can find resources, counseling, and all sorts of things like that. So basically what I'm saying is, recognize that something is wrong, reach out to people, and also be reaching out to people who you've not heard from. Is there something wrong with them? and reach out to your health professionals. There are, resources available from your surgery, which they will, send to you. Or if things are really bad, it might mean that you need, to be on medications if necessary. But the most important thing is recognition and reaching out and asking for help. Don't keep quiet. We're used to, I don't want people to know that something is wrong with me. I don't want people to label me with depression. These are real health conditions like diabetes and hypertension. We should learn to see mental health conditions like depression, anxiety, like those kind of conditions ourselves, and not, feel bad or shy away from labels, so that we can get better. Thank you.
Thank you. Thank you, ma'am. Ngozi?
Thank you, Dr. Adisa, for that information. I also work in community. I just wanted to add, I work in community, and most of the people that I work with, they do suffer mental health. So if it's of any use to anyone on this platform listening, if you are worried about your mental health, there are numbers that you can contact. You can contact Samaritans. You can also contact Mind and My Sister's Place for any kind of counseling that you may need. And like Dr. Adisa did say, please check in on people and ring people that you feel you can talk to and more or less lay your concerns and burdens on, and they wouldn't really bother too much, But we have a question here from someone who said, I'd like to direct the question to Dr. Talks. It says, what are the practical ways to boost immunity within our community?
The practical ways to, boost immunity, jokingly, is actually get infected, you develop immunity to it. But speaking seriously, some of the things that we've actually talked about, other speakers have talked about in terms of, eating well, good health and all that. Keeping healthy actually helps one to boost, develop, the immunity being strong. And then there are the other bits, which is what we now have the vaccines for, all the vaccines, preventable diseases, the advices, and that's why in childhood immunization and all that through the life course, make sure our children don't, get all the necessary vaccines at the different stages up to school age and as an adult. And as some of us are aware, for the flu seasons, we have the high-risk group and the elderly, which is every year. And this is where there's also the research into and now testing vaccines for this COVID-19 this time. So in a nutshell, the practical, the ways is that where there are vaccines available for the vaccine preventable diseases, where it's relevant to us, either in terms of our age, our children, especially school age, and as adults or in the high-risk groups, we make sure we're up to date with our vaccines. We eat healthily. We try and maintain a healthy lifestyle. We've talked about mentioned vitamin D. And then it's just also the bit about, the other bit then is also keeping safe. So I just put it that way. And so really all these conspiracy theories about vaccines, it won't be developed, about trying to wipe out whatever race in the world, they're not, I don't think it's the right thing. And then we should be conscious also that we have the anti-vaccine groups. Having vaccine is one of the public health breakthroughs, looking at the milestones after the Water Snow project. I'll stop there.
All right, thank you. Thank you. I think there's a question here. Somebody asked that, he said, I think we have skipped the question of men being predisposed to COVID-19.
Is that for me or for somebody else?
Yes, please. Can you continue with that, sir?
Well, I guess it's a bit of, it's what we've seen from the statistics, and we then now go back to, okay, why why should it be so? And then if you then look at in terms of women, it's almost like that same question. Why do women live longer than men? They have longer lifespan than men. And it's just that bit of some of it might be around a man's attitude to healthcare, but then some of the areas where we're talking about the high-risk groups and the predisposition to some of those morbid states might be issues where men are more predisposed to those ones. So gender might just link with those morbid levels of morbidity or the level of risk at that time. I don't know if my colleagues have other things to add on to that.
Okay, thank you, sir.
Yes, it looks like Debola wants something.
I think you're right, sir. It's just based on available statistics and data right now. Why it is so in terms of gender, no, I'm not sure we know beyond the fact that that's the data that has been collected. But I guess there are other things that I've had a few private messages, people asking why are BAME more affected, and maybe dying from, COVID-19. And I know people are quite worried about that. Again, it is, I think Dr. Shangar already addressed that at the beginning in terms of, there are a lot of things they're suggesting are, maybe responsible for that, including socioeconomic status, but that, we all know that doesn't completely address it. But there are other issues such as comorbidities, which Dr. Imoy has already explained. So diabetes, hypertension, they're well-known, comorbid with ongoing health conditions that seem to be more represented in people who had this infection or have died from it. I think the other thing is occupation. Is also quite important. They have found that quite a lot of BAME health professionals have actually died from COVID-19 because of the demographics. They have maybe found that more BAME seem to be at the forefront. I think Dr. Adedapo also mentioned that they seem to be there at the forefront, working in that kind of environment where they are likely to be in contact with people who, have been infected with COVID-19 and are exposed as a result of their profession. But there are other reasons, I'm sure, which maybe we will learn later. But I think the most important thing and key thing we need to get from this, and we need to be telling our family members and friends, especially of the BAME communities, we need to own our own health. We need to be more conscious and more health aware. We need to know what's going on, So like Dr. Imoy said, there are risk assessment, and your workplace, your employer needs to be risk assessing you. You need to be aware of, you are entitled to a risk assessment. If you have an underlying health condition, diabetes, hypertension, you shouldn't keep quiet and just go to work for going to work's sake. There are a lot of things beyond earning. You have to be alive to earn. We need to own our own health and be responsible for it. Nobody's going to come and say, oh, you've got diabetes and hypertension, stay at home. If they don't know, you're not telling them you are at high risk, and you're not asking them that, they need to risk assess you. Basically, we need to be owning our own health and be health conscious and aware. Thank you.
Thank you. Thank you. Dr. Imoy, I sent a question to you. Can you respond to that, please? It's talking about stigmatization, discrimination against COVID-19 positive patients. Did you see it?
So definitely we should be against stigmatization or discrimination of anyone who's got COVID-19, because it's not their fault. They didn't put it on themselves. And the best way to do this is to create the awareness amongst ourselves that even if someone does have this, we don't have to run away from them. We don't have to treat them a certain way. We don't have to discriminate against them. And even though there's no cure for it, not everyone that has COVID-19 has severe symptoms or dies from it. There are people that have had COVID-19 and have had just mild symptoms and they've recovered from it. And the only important thing to help people know that they should not discriminate is to, again, going back to what I said in the first stage, is taking precautions. If we take the right precautions with ourselves, protecting ourselves, even those of us that are not healthcare workers, when we go out, when we interact with people, if we protect ourselves properly and reduce our going out to only if it needs to be, to be done, then we would obviously be protected from contracting the virus. But if we find ourselves among people that or someone you think might have had the virus, is just to be nice, be kind. That's the theme for this week, be kind. But obviously take precautions. When it comes to stigmatization and discrimination, as healthcare professionals, we might have no option because some of us have to work directly with these patients or in the COVID ward. And how are you going to discriminate? It's not even ethical to discriminate against them. You have to take care of them. And if they're in the community already, it means that, obviously their symptoms are either very mild or moderate and manageable. But if anyone knows anyone who's got COVID-19 around them, it's just to be, be kind. Obviously, you take the precautions that you need to take and keep social distancing or isolate from them, definitely. But, we should not discriminate against them, any culture, any race, it's not right. I'm totally against that.
Thank you.
Can I just add to that? And I think maybe it's the clarity about that question. Is it discrimination against people who have recovered from COVID-19? And then I think it's that bit of, with the person who asked the question, what's the definition of discrimination? Because if there's COVID-19 patient who is COVID-19 positive, all the social distancing, self-isolation for that patient and all that might be regarded as discrimination. That's why the first sentence or first message that Dr. Mai mentioned is about education. That we need to educate the community and realize that if you're self-isolating or quarantining or keeping distance, social distancing, or using face masks to talk or communicate or consult with a doctor, it's not discrimination for that. So that we then, our community then don't say, or when they are saying black, they don't want to keep, they're keeping their distance with black, or it has to do with face mask and all that. So that word education, it is very good and raising, it is very important, raising awareness so that people, at least based on what we know so far about this disease, people should be aware about how do we keep ourselves safe, and that may be seen as stigmatization, just like we had with HIV, which we still have amongst our people. If you're HIV, people run away from you, which was one of the problems. People then were hiding their status. Some having to go to Newcastle, for example, for treatment rather than here because they don't want those chances. So that's the bit I just want to say to pick up on Dr. May, that the issues about education and awareness in our community, of our community, is very key so that we don't then get misconceptions.
All right. Thank you, sir. Dr. Soyadidako, are you still with us, sir?
Yeah. I haven't gone anywhere.
Yeah. I sent a question to you. Have you seen it?
Well, I've seen it, but I wasn't sure whether it should be. You say why? The question about why more blacks have died.
Yeah, somebody sent it to the group.
Oh, there's plenty of reasons why black people are dying off.
Okay.
Number one, you're not in your country now.
Can we see your face, please?
Oh.
Let's see your face. We don't know who we are talking to.
Yes, I'm still here, Gary. So, look, it's very simple, really. You're not sitting where you're supposed to be sitting. My missus has just shown up. So, okay, lots of different reasons. Number one, okay, I'll talk about the. Bratukum was just laughing his head off. I'll give you the biological reasons, And then I'll give you the social reasons why we're all dying off. Okay, better listen carefully.
Okay.
But
We are recording it anyway.
And both are equally valid. You can laugh, but they're valid.
Okay.
And I've seen it. Biological reasons. Number one, all of us, if you do a vitamin D assay on all of us right now, our vitamin D levels in more than 50-60% of us will be low. And everybody has, every single study that has come out is beginning to show that if your vitamin D levels are low, you get a more serious disease from COVID-19. So if you are going to get a slight flu or a small cough, you will reach hospital if the vitamin D level is low. Now, for us Black people, the reason why our vitamin D levels are low in this country is there's no sunshine. And the further up north you live, the lower your vitamin D levels are. In fact, several years ago, the BMJ has had several studies that are published studies that suggest that people like us, and the blacker you are, the worse for you, should be taking vitamin D supplements. I would personally recommend that as part of your annual health checks, once you reach 40 or whatever, you should be getting vitamin D levels done when you check your blood sugar, your blood pressure, and all that.
They don't check it routinely.
I know they don't check it. I don't care that they check it routinely or not. The country wasn't designed for you. That's why they don't check it routinely. It's not your country. Go home.
You're supposed to be on supplements regularly. Sorry for
stop the supplement.
Yeah, it's okay. It's okay.
That's why I told you to come and replace me. You refused. So let me talk. So that's one reason. So you all go and check your vitamin D levels when you get a chance. And if you don't have a chance, take supplements. You can overdose on vitamin D though. So don't take too much. Read the label when you go to Tesco. It will tell you how much to take. Be taking the amount that the supplement tells you to take. Me, I'm a medic. I can take whatever I like. So I know I'm going to need more, so I take more. Because I'm locked up in the house all day. And working as a surgeon, you don't see sunlight most of the time. So it's even worse for me that I don't go out when the sun is shining. Okay? So that's one reason. The second reason is because a lot of us have predisposition to essential hypertension. Black people, okay, Nigerians. That's why anybody that's over the age of 35 who still has friends in Nigeria, every now and then somebody calls you and said one of your friends dropped dead. Now the reason they dropped dead is not because somebody did them. It's because they had a stroke. And the reason they had a stroke or a heart attack is because they got blood pressure, they never checked it. And the blood pressure reached a certain level. You know how pressure is going up and the valve blows, their brain blows, they die. Nobody did them. Now the trouble is because we have problems with essential hypertension, some of the medicines that they used to treat these Black people in their 40s and 50s apparently expresses what they call little proteins called receptors inside their body, inside all their cells. And those proteins act as magnets for COVID-19. So you can imagine you got corona is looking for you, your body is looking for corona because it's got all these receptors. So it's so much worse for you. So instead of white people, the corona will show up, there's nowhere to land, it passes out in their system, they sneeze, it comes out. In you, because you've got high blood pressure and you're taking some of these medicines, it's worse for you. So some of those comorbidities in Black people actually makes it much, much worse for us. On the other side, on the other hand, however, one of the things that we think works for us is those of us who are Black who've had BCG, the shot for tuberculosis. Some of the studies that have been done show that the disease can be a little bit milder in those people. Okay, so lots of different reasons, but some of them biological and some of them social. The social ones, they're as effective. When this coronavirus thing started, a lot of people didn't have PPE to do their work with. Bus driver, nurses, this, that, the other. But of course, then they didn't know that it was going to affect us that badly. But nevertheless, a lot of these people that did not have their PPE properly, even when they complain and say, I don't have enough PPE, they will say, shut up, go and do the work. Okay. Some people did complain and they were told to keep quiet. One of the doctors that died specifically complained to the Prime Minister that he did not have enough PPE. It's documented, it's in the press. Okay. Who's less likely to go forward if they say keep quiet? Black people. How many black people can tell their boss that keep quiet, I'm not going forward? We don't do things like that. If they say you must do the work, you do the work. So these are some of the factors that have contributed significantly to ethnic minority people dying from this problem. Because some of them didn't get enough protection. But of course, you add protection. You have to understand that with all these things, it's not one thing that kills you. It's a sum of different little problems added together, and then that's it. So that's my take on it. Sorry. I hope I haven't said anything that CIA will come and carry me.
Ngozi, thank you, sir. Ngozi, do you have anything to ask?
Yeah, I wanted to find out, for someone who's had coronavirus, is there a way of finding out if they've built an immune? And if they have built an immune, is it possible that they can get it again?
I've just a quick answer, because it's a particular area that I'm interested in. If somebody's had coronavirus before, like that my friend that I said went and they told him to sit in his house, who's well, nothing's happened to him. He said they should come back in 7 days' time. I said to do what? They said you should come back to work. So 7 days later, he's gone back to work. We don't know whether he's giving corona to everybody in the workplace now. No one knows. Because they said they won't test him again. They don't know enough about this problem. So the Chinese people think that you get antibody levels. You will get antibodies. That's how you fight any infection. You get IgG, you get IgM. The trouble is, no one knows how long those antibodies stay in your system. And no one knows whether that antibody protects you for 6 months, 1 year, 2 years. There are things we know though. This your cold that you catch cold every now and then, and this your flu virus that you get flu jab every year. They're all coronaviruses. This one is just a different coronavirus, a mad one. It's like coronavirus, it went crazy. So, but we know that your flu virus, which is also a coronavirus, you have to get a shot every year for it. The GPs can correct me if I'm wrong, because I'm not a doctor. I'm only a surgeon. So going forward, I suspect even if you win with this particular coronavirus, all these doctors looking at me and laughing at me, we still have to give you a shot every year. So this is not going away. You will get shot every year, or dodge it like me. So
there is the new antibody testing we have been promised is coming out. And
everything has been coming since. We are still sitting there. So
we're learning. The question you raised actually is, yes, we might then do antibody tests and look at the titer, which gives you whether you've had the infection. Now, the answer we don't have is, are you then immune to it?
You protected.
There's been a case in China where somebody who's had it now had it again, but what they're saying is whether he actually at that point it was a reactivation rather than a new infection, and that's been looked at. But if we look at this one, it's a flu, virus that is gone mad in Sonya's definition.
Yes, now it's orthopedics.
The one that has not gone mad, we need the vaccine every year. If you remember the last flu pandemic where we had all this antiviral, and then we had a vaccine, because developing flu vaccine is done a year ahead, where GPs order that will fight against a particular strain. That was a year that the vaccine that was developed did not fight. We had a different strain that vaccine did not work against. Yeah. So if we look at that theory, the best we can get from if the best we get from one virus, similar virus that is not mad, is 1 year immunity. The one that is now mad, we will get up to 1 year immunity, or because it's madder, we will get a bigger, a longer level of immunity. We don't have an answer to that. And we've had SARS, which we have not had again. So there's all those theories in terms of immunity. But for now, if you are treated and you survive COVID-19, the advice is still that you continue keeping safe, because you might even then be more vulnerable, or if you ever come down with it, and that's the challenge. The only testing we're having, we want to have that antibody testing, is so that we can get the likes of all these doctors to go back to work, so that they're not sitting at home being isolated when they don't have it. So in a way, it is actually to protect the service and patients, and it's for the for the immediate period.
All right. Thank you, sir. Dr. Adebola, there's a question sent to you.
The question is, we hear of selective treatment of COVID-19. Is this true, or could this be part of the death among the BAME community? So if I understand this, there are some people who have COVID-19 because they're BAME, they're not being treated. In terms of treatment, I'm imagining you're talking about maybe ICU treatment, or because based on what we've heard so far, most people will recover from a mild illness, a moderate illness where they're going to be okay, unless they then go on to have maybe a pneumonia or a reason why they need to be admitted to hospital or to the ICU. I'm going to assume that's what this question is means. I cannot say that I know of any particular situation where I know of a BAME person who wasn't treated, and I cannot say that I've not heard that in the news or media either. But what I can say is, if we know of any situation like that, we need to be speaking out about it. We cannot depend on speculation, or this is what people are saying, or this is what people are not saying. We need to be, if we know people who can speak, if we can't speak out, we need to be passing such information to people who can speak out. I think that's the whole essence of all what we're doing today, awareness of the fact that there are things that are not acceptable. If people are being discriminated against because they are BAME, that is obviously discrimination and it's not acceptable. And we cannot, I suggest that we don't keep quiet. If we know of such situations, we should be bringing it out to the fore so that it can be addressed. But I personally I don't know of any specific situation, so I cannot speak specifically. But in general, I think, and I believe strongly, that if there is any case of discrimination, it should be brought out to the fore. I'm going to pass this question on to to Dr. Shongowawe to help me out. It's for the
elders. Okay, Dr. Tux.
Yes.
Okay, sir.
It is about selective treatment.
Okay. Yes.
Well, let's put it this way. It would be disheartening if it's true that doctors are discriminating their treatment because of the Hippocratic oath we all took as doctors. And like Debola said, if we know of that and we can substantiate it, it's something that needs to be raised and pushed forward. Unfortunately, like we said, there are a bit of hearsays. There's a lot of that, especially coming from America, and which is quite different from here in terms of their healthcare and their funding bits. At times, we're not aware of this current system that we see, that our colleagues in the hospital use, where, depending on your level of score, the protocol of management differs. But if it's happening and people know about it, my advice would be, okay, if one cannot, like Debola said, we've got to be able to shout about it. and look at ways where we can, and then get the real facts and push it forward. Especially at this point in time that the government led by Public Health England is trying to look at the reasons why we've had more deaths in the BAME community compared to our white counterparts, especially where we would have removed socioeconomic, we will have control for socioeconomic difference. Because amongst our colleagues, especially the doctors who have died, there's been more death amongst those ones who are from the Black and ethnic minority groups than the whites. So there is an opportunity, if we know of that, to try and raise, and there'll be different channels where it can be taken through. And I know British Medical Association also is quite keen to get responses from colleagues about their experiences on the front line.
All right. Oh, thank you. Dr. Imoy.
Yeah.
Okay.
I've seen your question this time. So yeah, my hands frequently, doctors. How often should I wash my hands? You should wash your hand as often as possible. It's your hand, it's not their hand. So wash your hands as often as possible. Every time you go out of your house and you come back in, wash your hands. Every time you touch, something, especially if you're at work, every time you touch, you maybe, even on your computer, even touching anything in the office, wash your hands. And if your hands are clean, you can always sanitize with the hand sanitizer as well. But hand sanitizers only work if your hands are clean. So make sure your hand is clean anytime you use the sanitizer, but wash your hands. And according to the guidelines or the hand washing techniques, wash your hands for up to 20 seconds when you wash it. Wash the front, the back, the side, the insides of your fingers, and in your nails as well, in your palms. So it's very important. You can wash your hand as many times. Of course, with washing your hands frequently, it might make your skin dry if you've got very sensitive skin, but it will protect you from germs, and not just the COVID-19, it will protect you, because even sometimes touching raw meat, raw fish, when you're cooking and not washing your hand properly can cause infection. And the easiest way to infect yourself, not just with COVID-19, any sort of infection, is orally. So when we touch our faces many times a day without even knowing sometimes. And so that's why it's important that we wash our hands, because sometimes you just pass things from your body. And another thing now, if you go to the shops, they've got sanitizers outside, they've got like toilet rolls outside. So you can take a sanitizer, wipe the hand of the trolley you're using, and if you've got hand gloves, you can wear your hand gloves and your mask when you go out as well. And it's just precautionary, measures for you. At the end of the day, you're protecting yourself. See it this way: if you wear a mask, even if it's a cloth mask, it might not look like something much, but it will do a lot of protection from, getting something else from someone else. So, just take the precautions. Use your hands, wash it as often as you want.
Thank you. Ngozi.
Hi. So I wanted to say that we have a question here from someone who said, how do people in a relationship but not living in the same home manage the foreseeable future given this social distancing?
Can I ask Dr. Adedapo to answer that? Not Mr. Adedapo, the real doctor.
When you refuse to go away now, answer the question.
Well, over the Skype, over Zoom, over WhatsApp.
We can see your face, please. We would like to, please, thank you. Please welcome Dr. Mrs. Adedapo.
That's the real doctor in Adedapo's family.
We can still see your face clearly, ma'am.
Sit down there.
You can sit on his lap.
Yes, exactly. That is accepted. That is accepted.
Answer the question now.
Yes, it's actually basically over the internet, really, and over the phone, over Skype, WhatsApp. I mean, as much as you can, really. I don't know why Uncle Tok said I should answer that question.
Talking from experience.
Yeah, we have an experience in our house. They stay over the Skype all the time. They are locked down. She's locked down over there, and our son is locked down here as well. So they just stay all the time on Zoom, on Skype, on which other one?
No, they just put it on WhatsApp.
On WhatsApp or Microsoft.
And then you hug the phone to yourself.
Yeah,
like that. And you start hugging the phone around the house.
Yeah, that's basically what they do.
But then again,
it's difficult.
Wait. It's not a bad thing, because go and read the health education, England, and this corona has done some good for some people. Because why are you looking at me like that?
Yeah, I want to know.
Because apparently, some people are asking why are they letting people go back on time? The coronavirus has not gone away. Blah blah blah. You're locking people up in the house. They may be married, but they hate themselves. And then you lock them for like 2 months, 3 months.
No, they're talking of people that are.
It's part of it.
Okay.
And if they don't like themselves very much, and you lock them up for like 2 months, somebody will kill somebody. And that's already happening because the rate of domestic violence,
has gone up.
Women being killed by men. Unfortunately, the women are not strong enough to kill the men, so it's the men that are doing the killing. That's gone up. Really gone up. It's part of what the government is thinking. I say there are other people dying. Some people have heart attack, stroke. They're not going to hospital because they think corona will kill them. Meanwhile, the heart attack and stroke is already killing them in the house. So you've got to balance. Life is about balance. You've got to balance a lot of these things, So if you've got somebody that is somewhere else and you are somewhere else, my son's wife is living in another country now, so he puts his WhatsApp on video and he hugs it around all day long, and they are talking all day long. That works for them. But for some other people who don't maybe love themselves so much, maybe that's an opportunity to run. So Corona has helped those ones. So one way or the other, it's like Yoruba people say, a cow that doesn't have tail, it's God that's helping him to chase the fly. So it's like that. So,
but I think it's still difficult and it can be stressful. But you just have to make use of the technology that is available.
Yeah, like this one.
Yeah. I'm sure Ngozi may have experience in our community work. The impact of lockdown, domestic violence, and all that.
Yeah,
definitely. Definitely. It's more. Sorry.
Please go ahead. Sorry.
we definitely experience it, especially with when Dr. Adisa was speaking about mental health. It's one that is on the rise now, especially with people who suffered anxiety and depression before the COVID-19 pandemic started, and then now they're isolating. Previously, they never used to come out, so our job was to see them, encourage them to come out, curb isolation in their lives. Now we're encouraging them to isolate. So it's kind of like there's an irony in the message that we've passed in the past and now. So we're always trying to signpost them to services, especially health services that are there to offer counseling. Even some services are not even working because you can't have that face-to-face counseling anymore. So everything is over the phone. And then you also have the part of we who are working from home, you have that stress of your lockdown. If you have children at home, you're not just doubling as a community worker, you're doubling as a mom, a community worker, a teacher, a dinner lady, all the things we never used to do before. We're doing it all at the same time. And you as a community worker, you're also experiencing the stress. So I think everybody is experiencing this in their own little way. And hopefully when it's over, we will all come out with something lesson learned, I think.
Can I just say something, please?
Okay, yes, please.
I think
in as much as we're looking at the negatives, we need to also look at the positives, because I believe that coronavirus and the lockdown has also opened our eyes and our hearts to see a lot of things that we've not been doing. For most people, they've ended up spending more time with their families, bonding, having time with the kids. Normally for us, it's just drop them in school. After school, they go to after school club, pick them up at 6, have dinner, chat for an hour, so everybody's back to bed the next day. And that's how it goes. And I think during this lockdown, there has been opportunities to have many families are experiencing this as well. So we can look at the positives as well, and learn from it of how we will shape our lives after COVID-19. Me and my family, we've been going for walks together. We've been a lot of bonding, preparing the garden together. And I think a lot of families have had time to play board games together. A lot of people are on TikTok doing family things together. So I think we have to look at the positives from it as well and use it to plan, because we're not going to go back to life as we knew it. Life, this is the new normal. So we need to plan our lives around this new normal, how we're going to continue from here. So,
I think we have spent up to over 2 hours now. We should be rounding up. Do any of our medical experts, do they have any other thing to tell us?
Okay, I think yes.
All right.
No, it's just an interesting question here. Does intermittent fasting, is this beneficial to tackling COVID-19?
Who respond to that, please? Dr. Adedapo, Dr. Sawyer. Please unmute.
Mute. It's all right. Don't fast during COVID. Because your immune, if you overeat and you overdrink, your immune system is depressed. The same way, if you fast a lot, you depress your immune system. So if you say you want to be doing intermittent fasting, depending on how badly you are fasting, especially if you're not drinking water, fluids, you're going to damage your body. But that's the GP shop. Maybe they will tell you it's okay. But for me, if you are fasting during Corona, it means you are already deciding to write your own death sentence. I fast during Corona.
So it's not advisable to fast during this time.
I had a colleague in London who had who was infected. Now, whether it's mild or medium, but he said it was the pounded yam and all this. It was getting pounded yam and pepper soup.
Yes, pepper soup will work for Koro.
Yes, and that was his own explanation.
It will work now. It's hot. Don't fast, though. I didn't tell you.
Anyway. I think we might be coming to the end of this session of the program right now. And I want to use this opportunity to say thank you to everyone that have been participating one way or the other, especially to our medical doctors, our medical experts. And before we go, please, can we also seize this opportunity to clap, to give round of applause to all our key workers who have been out there saving lives. And until another time we come your way, I want to say thank you and thank you. Thank you, Dr. Tokes Shogowawa. Thank you, Dr. Soya Didapo. Thank you, Dr. Imoyi. Thank you, Dr. Adibola Adisa. Thank you, Mrs. Funke Agbekwe. Thank you, Mrs. Kewe Omorago. And thanks to you, Dr. Mrs. Adedapo as well, for joining in, for the love of the nation, for the love of the community. God bless you all. Until next time, this is Tola Chidayoba. And thank you also, Ngozi Ochuba. I can't go without saying thank you to you. And to all iBishop for the Free Media team. You are all very, very, we thank you all. You've been very, very fantastic. Thank you. All right. Till next time. Thank you.
Bye.